Thanks very much. You'll find some themes emerging from Alexis's talk earlier, but also some specifics around IBD. So thank you again for the invite to be here today. These are my disclosures. And what I'll try and cover, again, touch on transfer versus transition, introduce that concept of developmentally appropriate healthcare, have a look at what does good look like, and then touch on a clinical case, and then summarize at the end. So most of you will be familiar with this, but just important concepts just to get right. So transition is that process. We've already heard it's that planned move of adolescents and young people with long-term conditions from child-centered to adult-orientated healthcare, whereas transfer is simply that event. It's that successful handover of care to adult services. And transition continues well beyond transfer. And so just introducing that concept of developmentally appropriate healthcare, and that's the sort of umbrella term that covers healthcare for young people. So it's looking after adolescents, whether they are in the children's services or whether they're in the adult services, and recognizing that transition is sort of part of developmentally appropriate healthcare. Adolescence is a distinct developmental stage, and this nice sort of study demonstrated how the brain is continuing to develop well into mid-20s. And that's why some of our consultations and the questions that we ask in clinics are sort of framed recognizing that developing brain and developing from that concrete way of thinking to a more abstract adult way of thinking. So, for example, questions in clinic, such as what brings you to clinic today, could be answered by a concrete thinker as, well, my mum brought me here today, or I came by the bus, etc. Whereas a more abstract thinker might say, sort of detail the problems that brought them to clinic today. So it's that thinking about what's happening in the short term versus sort of thinking a little bit more in the sort of medium term, in terms of processing information, and that sort of exemplified sort of in this study showing how the brain develops. The other sort of concept to think about may also be around risk-taking behavior, which is often seen during adolescence, and how that can impact on medication adherence. So how the questions are framed, again, thinking about how we frame those questions in our consultations. So what is developmentally appropriate healthcare? And this reference is quite nice in terms of highlighting sort of good practice that can be used to provide developmentally appropriate healthcare to young people. And this slide highlights the proposed definition, which is that it recognizes the changing biopsychosocial developmental needs. And I've highlighted the keywords in red. And so it's about empowering young people by embedding health education and health promotion in consultations. And this is whether they're seen in children's services or if they're seen in adult services. So what does that mean operationally? Operationally, it means this is the approach healthcare professionals take and the engagement with each young person and their carers alongside the structure of the organizations in which care takes place. So just to sort of go through that in a little bit more, this was a nice scoping review that was published in 2016, and this was looking at the understanding of healthcare professionals and managers in the NHS in the UK, and there were 5 key themes that emerged, and this was that developmentally appropriate healthcare recognizes that young people are a distinct group. They're different from children, they're different from adults. It's thinking about their biopsychosocial development and sort of holistic care. It requires young person-friendly healthcare, which adjusts as a young person grows and develops, and it recognizes complexity. It is about empowering the young person, so it is about ensuring that they have had education about the disease, about the medications they're on, but it's also about that life course approach and recognizing that the support needed may be different. One 16-and-a-half-year-old might be very independent, needing very little support, very articulate in their consultations, but there may be another 16-and-a-half-year-old or a 17-year-old who may need more parental support. And although it's good to be clear about expectations in terms of what's needed, in terms of ordering your medications or seeing healthcare professionals independently, it's also recognizing what support each young person needs. And importantly, it's recognizing that developmentally appropriate healthcare is interdisciplinary and also interorganizational.